So recently, I took care of a patient called as John, who had uncontrolled diabetes with the A1C of around 12. I still remember John very well because he actually came to me with ankle pain. So I'm a family medicine doctor and a sports medicine doctor. So he came to my sports medicine clinic and his complaint was ankle pain and he was thinking it was due to the previous ankle injury that he has had. After a thorough physical examination, it felt that his ankle pain was more neuropathic in nature. So basically it was more like a nerve pain. So I asked John whether he has diabetes and he said it's well controlled and he takes a drug called as metformin 500 milligram twice a day, but he hasn't checked his A1C for the last 2 years. Recently, almost like a month before, I saw John and his A1C was 6.4 with no medications. He's exercised regularly, he changed his lifestyle, he improved his fitness. Now the biggest question is that, did he reverse his type 2 diabetes? How was he able to pull it off? Is he genetically gifted? Can everyone reverse type 2 diabetes? What does it actually mean reversing type 2 diabetes? So today John is happy, right? He doesn't have any nerve pain, his A1C is under control, but I still see him every 6 months. If his diabetes is reversed, then why am I seeing him every 6 months? So in this video, I'm going to walk you through the John's journey and how he was able to help get his diabetes under control so that you can be benefited by that too. Okay? Without further ado, let's get started. So when John presented with the A1C of around 12, his average blood sugar was running around 300. He was doing a seated job at work. His breakfast was usually some sort of bread and eggs. He would never miss his Starbucks coffee. I still remember John mentioning that he would be glued to his seat the whole day, but he never liked that part of the job. But John was so proud that he would come home and he would do a walking for 30 minutes daily. So usually in the afternoon, he would have a sandwich with some meat. At workplace, they'll bring donuts. And he never binged on them though, but he still would eat without regrets. He has 2 kids at home, he has a lot of stress at work, and he was even thinking about quitting job. He would go home around 7 p.m. to eat dinner. Again, he would eat like pasta or bread with corn. He enjoys 1 Coke per day, not more than that. And as I mentioned, he always would go for walking 30 minutes a day. And actually when you look at his BMI was not that bad. His BMI was around 32, but still that puts him in the obese category as per our definition. So when I showed him the A1C of around 12, he was shocked. I would even say that he was basically shattered. And the biggest frustration that he had is that I'm doing walking 30 minutes daily. I'm taking the medication metformin twice a day. When I'm doing everything right, how is this even possible? So before we proceed, let's understand the drug, the metformin that John was taking. So metformin is a common drug that is prescribed for diabetes. It's actually a very old drug. When there is insulin resistance, which is the major problem in patients with type 2 diabetes, coupled with insulin deficiency, or other words, the pancreas not able to meet the demands of the insulin resistant, the liver does not respond to insulin. So liver is actually one of the storehouse of glucose, and they release glucose into bloodstream when necessary. For example, when you're exercising without eating anything, the liver pours glucose for the exercising muscle. So this doesn't happen at rest because the insulin keeps a check. Let's say when the liver is not responding to insulin, in this case because of insulin resistance, the liver pours glucose causing the blood sugar to go high. Metformin basically prevents that from happening. Some studies have actually shown that the metformin can decrease risk for heart disease and even decrease the risk of dying from diabetes. So that particular day, I also checked his B12 levels. So basically I checked methylmalonic acid, which is a pretty accurate indicator of B12 status. The reason I did that was because metformin can sometimes cause B12 deficiency. And sometimes the ankle pain that he is presenting with could be coming from an underlying B12 deficiency that is causing the neuropathy. But fortunately, his B12 levels, which is basically the methylmalonic acid levels, were normal. So usually with the A1C of around 12, I talk about insulin. Because when someone's blood sugar is really high, there is a chance that his pancreas is not working properly. We call this glucose toxicity. It's basically a theory where the pancreas can shut down because of glucose toxicity, basically high sugar causing the shutdown of the pancreas. So however, John did not want to try insulin at this time. He wanted to try something different that can bring his blood sugars under control, and I think that's pretty reasonable. But the biggest frustration John was having was that in spite of doing those 30 minutes of exercise, which the doctor told him to do, and then taking the medication, the metformin twice a day, how come the blood sugars went out of control? I wish managing diabetes was this easy. So I had to sit down and explain about type 2 diabetes. So type 2 diabetes is due to 2 things. So one, there is insulin resistance. The other most important thing is that the pancreas is unable to meet the demands of the insulin resistance. So let us say when you have insulin resistance, you need more insulin. But let's say the pancreas is not able to produce that more insulin, then eventually the blood sugar goes up. So let's understand how one develops insulin resistance, or what is insulin resistance. So let us say you eat too many refined carbohydrates like bread or sugar. Our insulin secretes from pancreas to keep the blood sugar down. So some of the glucose gets used up by the exercising muscles. The rest of the glucose gets stored in the muscle and liver, and the excess glucose after that, they get converted into fat. So we all have fat stores in our body. So there are fat stores that are present outside the organ that is called as the subcutaneous fat, and the fat stores that surround the organ which is called as the visceral fat. So as you can see, John actually eats a lot of highly refined carbohydrates like pasta, Coke, and he doesn't eat a lot of vegetables in his diet. In addition to that, John has a sedentary lifestyle. So we just don't understand why one develops insulin resistance and one doesn't. The prevailing theory is that we all have different levels, different amount of fat stores in our body. So for example, let us say we have one person has like 5 bags of fat stores on the subcutaneous fat. The other person might have only 3 bags of subcutaneous fat. So once they fill that 3 bags of subcutaneous fat, the rest of the fat just goes around the organs. And our body doesn't like that, which is why our body starts developing insulin resistance. So basically our body says that, you know what, we cannot just keep putting the fat around the organs, so we need to stop this from happening. And this leads to insulin resistance, thereby causing the pancreas to secrete more insulin to overcome the insulin resistance, and thereby this diabetes develops eventually because the pancreas is not able to keep up the demands of the insulin resistance. So as you can see here, John is basically unlucky because he has a low threshold of developing diabetes. His BMI is 32, but he has an uncontrolled diabetes with the A1C of 12. So at this point, I have 2 options. So one, I can actually provide him insulin and then not change his lifestyle, let him live the sedentary lifestyle, let him eat whatever he wants. And then I can, basically what I'm trying to do is I'm trying to give more insulin to overcome the insulin resistance. But the other option is basically I can improve his lifestyle and thereby helping to decrease his insulin resistance. At the same time, I may give him insulin, or I might give him some medications to get his blood sugars under control. But the goal is to decrease the insulin resistance and thereby decreasing the dose of the medication that he needs. This is probably the best thing to do for John, and I'll tell you more as we kind of keep going forward with this video. So basically what I did was that I increased his metformin to 1000 mg twice a day, and I added another medication called as the exenatide, which is actually an injectable medicine, but it's not an insulin. So exenatide is a GLP-1 analog medication. So the GLP-1 is a hormone that is secreted by intestine. They release insulin when the sugar is high. They help to decrease the appetite. They suppress the hormone called as the glucagon, which actually causes the sugar to be poured from the liver into the bloodstream. In addition, GLP-1 analog is thought to decrease inflammation in the pancreas, which is what John is fighting because of the high glucose that he has been having for quite a long time. So basically, I started him on these 2 medications. Then I told him to walk for 5 minutes for every 1 hour sitting. And I told him it doesn't have to be brisk walking, it could be just for going for a stroll. And then I told him to check his fasting blood sugar for the next 2 weeks. In addition, I told him to finish his dinner before 6 p.m. So when I saw John in 2 weeks, his fasting blood sugars have already improved. His fasting blood sugars are running between 150s to 170s, which is a pretty big improvement for him. Then I asked John about whether he knows the concept about glycemic index and glycemic load, and John had no idea what I was talking about. So the glycemic index is a measure of how quickly blood sugar levels rise in response to consuming a certain food relative to 50 grams of sugar. So in order to promote stable blood sugar levels, it would be beneficial for John to incorporate low to medium glycemic index foods into his diet. I'm going to attach the glycemic index chart in my description box, which you will have access to it too. So as an example, I would consider replacing his morning breakfast with oats and his afternoon meal with whole grain pasta or something like that. So as you can see here, John does not eat enough vegetables in his diet. When asked about this, John basically said that he tried consuming vegetables because his doctor told him to do so, but then he didn't like the taste of it. So basically he boiled some broccolis and carrots and he tried eating it and he didn't like it. To be honest, I wouldn't enjoy it either. Cooking vegetables is also a skill. Fortunately, there are a lot of YouTube channels that focus on healthy cooking, and I told John to research some of the YouTube channels that he might enjoy in order to incorporate healthy cooking into his diet. So I gave John one example. So I said, cut the broccoli, steam for 1 minute, immediately rinse it in cold water and keep it aside. Now either he can make his own hummus or he can buy hummus And that's a great way to incorporate vegetables into his diet. It's a good snack too. So John started to incorporate a lot of vegetables in his diet, and I told John to consume at least 2 cups of vegetables during each meal. So he was starting to do so, and I told him to just keep the carb serving to less than 50 grams per meal. And I told him that if he can avoid carbs altogether for dinner, that'd be perfect. And John was pretty excited because he said that he started enjoying the salads more, so he's going to just substitute with a salad during dinner time. So I saw John 1 month later, and he's already lost 4 pounds. And he is actually enjoying, that's some key thing, is enjoying the healthy lifestyle, the salads, enjoying the vegetables. And then John is also kind of happy to see his fasting blood sugars remaining at like 130s, 140s and stuff like that. But John was like asking me, like, he apparently went on a party and then everybody was enjoying a cheesecake and he was not able to enjoy the cheesecake because one, it is a high glycemic index food. The other is that it also has a high carb per serving. And John has already eaten his regular meal with high carbs. So then I asked John, like, have you ever learned about the concept of glycemic load? And John had no idea what I was talking about. So the glycemic load takes into account both the quantity of carbohydrates in a food and its glycemic index. So it gives a more accurate representation of how specific amount of food will affect the blood sugar levels compared to just using the glycemic index alone. The formula for calculating the glycemic load is glycemic load is equal to the carbohydrate content in grams per serving, multiply glycemic index, and you divide that by 100. So I gave him an example with a donut. So let's say I want to enjoy a donut. How would I eat without affecting my blood sugar a lot? So let us understand glycemic load numbers. A glycemic load less than 10 is considered low. 11 to 19 is intermediate, and more than 20 is high. So let us say I eat 3 cups of white rice, and then I eat half donut or 1 gulab jamun, which is a pretty popular Indian dessert. Let us find out what the glycemic load is. In 3 cups of rice, your total carbohydrate per serving is around 133 grams. So glycemic index of white rice is anywhere between 60 to 80, depends on what type of white rice that we use. So I'm just going to keep an average around 60 for this calculation here. So the glycemic load comes to around 80, which is a pretty high glycemic load. And then let's take an example of gulab jamun. So assuming it's almost like a half donut, so 1 gulab jamun has around 25 grams of carbohydrates. A donut of a glycemic index is around 70. So using these numbers, the glycemic load comes around 17. And that's considered as an intermediate glycemic load. So how can I enjoy the gulab jamun or the half donut without affecting my blood sugar a lot? So this is what I would do. If I really wanted a gulab jamun that day, I would have eaten a salad rich in fiber. I would have probably had a little bit of lentils for my protein. And after that, I would have enjoyed that gulab jamun. So I see John 2 months later, and he's feeling energized, enjoying his healthy lifestyle, walking regularly 30 minutes daily, and his A1C is 6.4 with just metformin exenatide, and is really, really happy. So during this visit, I asked John, do you know what is the major killer in diabetes patients? And John said, is it kidney disease? And the answer is actually heart disease. So multiple studies have shown that fitness, both cardiovascular and muscular fitness, is tied to longevity. Yes, John is walking 30 minutes a day. That's great. But it's time that we think about fitness. So as usual, curious John wants to improve his life, and he asks, what do I mean by fitness? So basically fitness has 2 components. So one is how efficient your body can consume oxygen. So it's dependent on 2 things. So one is the strength of the heart that supplies the oxygen. And the other is the muscle mitochondria, which is the powerhouse of a cell where the mitochondria basically extracts the oxygen for fuel. The muscular fitness is basically how strong you are, and most of these epidemiological studies uses grip strength to measure muscular fitness. So John is 50 years old, and I asked him, what is the most important thing in your life? And John basically said that, I've got 3 grandkids, I want to enjoy life with them, and the most important thing is to make sure that I have a good quality of life so that I can enjoy time with my grandkids. And that's a great goal in life. In order to achieve that goal, you need to have a good cardiovascular fitness and muscular fitness. So in order to improve cardiovascular fitness, I told him the next time when he walks, I want him to see if he can talk easily. If he can, I told him to increase the speed of his walking. So he should be able to talk with full sentences, but still not really comfortable holding the conversation. This is the exercise intensity that I want John to maintain. Once he finds that level of intensity, I told him to record the distance he walks, and then every 2 weeks, I told him to increase the time that he walks by 2 minutes until he reaches total of 35 minutes. So once he's able to hit 35 minutes, then I told him to cover the same distance in 33 minutes. Once he's able to cover the distance in 30 minutes, then he can increase the time again by 35 minutes, thereby covering total of 35 minutes for walking, and he'll do the same thing as he keep increasing the intensity. So I told him to do this almost 5 times per week. So when I asked about strength training, so John said that he doesn't have time to go to the gym because his grandkids live with him and he has a lot of responsibilities with his grandkids, but he does have time to do strength training at home. So then I said, why not do strength training at home? So I shared my home strength training playlist with him, which you have access at the end of this video also. And I've also put that playlist link in the description box below. I told him the goal is to do 8 to 10 sets of strength training exercise, focusing on push, pull, hinge, and squats. And you just do that 2 to 3 times per week. I saw John 3 months later and his A1C is 5.8 with just metformin and exenatide. Then I said, let's stop the exenatide. He has lost like 15 pounds in the last 3 months. So then I said, just keep the metformin. And then he comes back again. He came back 3 months later and he has lost another 6 pounds. And I told him, let's stop the metformin. And I checked again in 3 months. His A1C was 6.4, which is the recent visit that I had with him. So not only that, John is accumulating almost like 150 to 200 minutes of moderate intensity exercise and is now thinking about incorporating high intensity exercise. So if you want to know about high intensity exercise, make sure you check that video that I've attached above. And in addition to that, he's been getting strength training almost 3 times a week. He told me that he can do 10 push-ups pretty easily. He cannot even do 1 push-up when he started. So John has improved both his cardiovascular fitness and muscular fitness considerably here. So as you can see here, John has not only controlled his blood sugar, he has cut back the risk factors of dying early. He has cut back the risk factor of developing diabetes in the future. Although he's diabetic, but he has also cut back the risk of developing diabetes in the future because he has gained muscle mass and he has got good insulin sensitivity. He has cut back the risk for heart disease, risk for stroke, risk for cancer. Some of the cancers are related to insulin resistance. And thereby, he's going to have a good quality of life. He can enjoy what he wanted to, basically spend time, a good quality time with his family. So the good news for you is that you can also get your diabetes under control by just following what we had talked about. And if John can do it, you can do it also. If you have any questions or comments, you can always put in the comment box below and I'll help you through your journey, okay? So now the question is that, did John reverse his type 2 diabetes? There's a misconception among people that when we say reverse type 2 diabetes, it means that you have reversed diabetes so that you can engage in unhealthy lifestyle. No, that's not the case. John always has an increased risk for developing type 2 diabetes, especially if he's going to switch to an unhealthy lifestyle. Because we know that John has a low threshold of developing type 2 diabetes. But let's say if John continues to incorporate healthy lifestyle, continues to focus on fitness, then the risk of developing type 2 diabetes is very, very low. So the other important question is that, can everyone reverse type 2 diabetes like John did? And the answer is, it depends. So some people may be able to come off medications completely. Some people may need to stay on medications. But the goal is to get the blood sugar under control with the least amount of medications as possible. Remember, the goal is to decrease the insulin resistance, and we know from studies that high circulating insulin levels is linked to early mortality, and by cutting back on the insulin levels, we actually improving mortality, which is what our goal is, that we need to have an improved quality of life. We need to make sure that we enjoy our life to the fullest without suffering from any problems that kind of compromises our quality of life. Okay, I hope this video is helpful. If you have any questions or comments, please post in the comment box below. I'm going to ask you a small favor. If you really enjoyed this video, please hit the like button, and I'll see you in my next video. Until then, goodbye.